Understanding Medigap, a helping hand for Medicare. Medicare is a lifeline for millions of Americans aged 65 and older, providing essential healthcare coverage. But even with Medicare, there can be out-of-pocket costs like co-payments, co-insurance, and deductibles. That's where Medigap comes in. Medigap, short for Medicare Supplement Insurance, is designed to help fill those gaps in your original Medicare coverage, potentially saving you significant money on healthcare expenses. Imagine Medigap as an extra layer of protection that works alongside your original Medicare Parts A and B. It's important to note that Medigap doesn't replace original Medicare. It supplements it. When you have Medigap, you still see the same doctors and hospitals that accept original Medicare. Medigap policies are offered by private insurance companies, and while they must follow federal and state regulations, the costs and specific benefits can vary. These policies typically don't cover everything, and it's essential to understand what's included and what's not before making a decision. Navigating the world of Medigap might seem daunting at first, but it doesn't have to be. By understanding the basics of Medigap, you can make informed decisions about your healthcare coverage and enjoy greater peace of mind knowing you have a safety net in place. Medigap is specifically designed for individuals who are already enrolled in original Medicare Part A and Part B. If you're under 65 and receive Medicare due to a disability or certain health conditions, you're also eligible for Medigap in most states. The ideal time to purchase a Medigap policy is during your Medigap open enrollment period. This 6-month window starts automatically when you turn 65 and enroll in Medicare Part B. During this time, you have guaranteed issue rights, meaning insurance companies cannot deny you coverage or charge higher premiums based on your health status. While you can buy Medigap outside of this enrollment period, you might face medical underwriting. This means insurers can consider your health history, potentially leading to higher premiums or even coverage denial. If you're generally healthy and anticipate needing healthcare services in the future, Medigap can offer valuable financial protection against unexpected medical costs. However, if you have limited income or resources, exploring other options like Medicaid or Medicare savings programs might be more suitable. Medigap policies are standardized, meaning they offer the same basic benefits no matter which insurance company you choose. This standardization makes it easier to compare plans and find the one that best suits your needs. There are 10 different Medigap plans, each labeled with a letter from A to N. Each plan offers a different combination of coverage benefits, with Plan A providing the most basic coverage and Plan N offering more comprehensive benefits. Some common benefits covered by various Medigap plans include co-insurance payments for hospital stays beyond the Medicare Part A benefit period, co-payments for doctor visits and other outpatient services, blood transfusions beyond the first 3 pints covered by Medicare, and skilled nursing facility care co-insurance. Understanding your individual healthcare needs and budget is crucial when choosing a Medigap plan. If you travel frequently outside the United States, some plans also offer coverage for emergency medical expenses abroad. Section 4. Medigap versus Medicare Advantage, making the right choice. While both Medigap and Medicare Advantage plans provide additional coverage beyond original Medicare, they work in fundamentally different ways. Understanding these differences is crucial for making informed decisions about your healthcare coverage. Medigap works as a supplement to original Medicare, helping to cover out-of-pocket costs. In contrast, Medicare Advantage plans, also known as Medicare Part C, are an alternative to original Medicare. These plans are offered by private insurance companies approved by Medicare. Medicare Advantage plans typically include Part A and Part B benefits, and often offer additional coverage such as prescription drugs, dental and vision care, all bundled into one plan. However, they usually come with network restrictions, meaning you might need to see providers within the plan's network to receive full coverage. Choosing between Medigap and Medicare Advantage is a personal decision based on your individual needs and preferences. If you value flexibility in choosing your healthcare providers and want predictable out-of-pocket costs, Medigap might be a suitable choice. However, if you prefer comprehensive coverage with extra benefits and don't mind network limitations, a Medicare Advantage plan could be a better fit. Section 5. Finding the right Medigap policy for you. Finding the right Medigap policy involves careful research and consideration of several factors. Before you start comparing plans, it's essential to determine your budget and healthcare needs. Start by reviewing the different Medigap plans available in your state, as plan availability and costs can vary. You can use the Medicare Plan Finder tool on the medicare.gov website to compare plans side by side and see their estimated monthly premiums. Don't hesitate to contact different insurance companies directly or work with a licensed insurance agent specializing in Medicare products. They can provide personalized guidance and help you understand the intricacies of each plan. Remember, choosing a Medigap policy is a significant decision that can impact your healthcare costs and overall well-being. By investing time in research and seeking expert advice, you can make an informed choice that aligns with your individual needs and budget. Section 6. Consequences of missing the Medigap enrollment period. What happens if you don't buy a Medigap policy when you're first eligible? Outside of your Medigap open enrollment period, you may have to pay more for a policy. Fewer policy options may be available to you. There's no guarantee that an insurance company will sell you a Medigap policy if you don't meet their medical underwriting requirements. They may deny you a policy unless you have a guaranteed issue right. Eligible situations are listed on pages 22, 23 of the Medigap Guide. It's important to understand that your Medigap rights may depend on when you choose to sign up for Medicare Part B. If you're 65 or older, your one-time Medigap open enrollment period begins when you sign up for Part B, and it can't be changed or repeated. In most cases, it makes sense to sign up for Part B and buy a Medigap policy when you're first eligible for Medicare. Otherwise, you might have to pay a Part B late enrollment penalty or miss your 6-month Medigap open enrollment period. However, there are exceptions if you have employer coverage. If you have group health coverage through an employer or union, because either you or your spouse is currently working, you may want to wait to sign up for Part B. Benefits based on current employment often provide coverage similar to Part B, so you wouldn't want to pay for Part B before you need it, and your Medigap open enrollment period might expire before a Medigap policy would be useful. When the employer coverage ends, you'll have a chance to sign up for Part B without a late enrollment penalty, which means your Medigap open enrollment period will start when you're ready to take advantage of it. If you or your spouse is still working and you have coverage through an employer, contact your employer or union benefits administrator to find out how your insurance works with Medicare. Understanding the timing and conditions of your Medigap enrollment can help you avoid unnecessary costs and limited options. Being proactive and informed ensures that you get the best possible coverage for your needs. Thank you for watching.